So anxiety is something that we can feel. And many times we feel anxiety through increasing heart rate.
We have psychologist and hypnotherapist Krisnan Hurdle joining us. Hi, Krisnan. Nice to have you
Hi,
with
good
us
morning,
today.
Peter.
You had a series for the first part, a 15-day series on mental wellness. And one of the ones that I found fascinating was the one dealing with coping with loss and with grief. The floor is yours. I'll give you a few moments, not as long as you took with that, but to break it down for us.
We also had a Frontline medical doctor who shared her experiences of how she coped with anxiety, having to work with patients in isolation facilities during the pandemic. And we also had, we just shared different tips on mental health issues, anxiety. We looked at a little bit at loneliness. We looked at depression and grief and loss.
What did the doctor advise when she was dealing with her patients, and especially the ones who were overcoming COVID-19? First of all, touch on anxiety, and then on what the doctor suggested for it.
Absolutely. Now, anxiety is a state of body and mind where there is there are stresses on the body. Most of the time is associated with anticipated fears, um, or memories of fears in the past, or anticipation of fears in the future. Or it could be produced by being in a stressful environment, whether it's work or home or any other stressful environment. And so having to be going all the time or having to be working all the time, and we know that that is something that many persons are struggling with, having that balance between work and home life because they're working from home. So anxiety is something that we can feel. And many times we feel anxiety through increasing heart rate. We feel our heart beating faster, or breathing faster. Sometimes we feel jittery or we say nervous. And some people sweat, some people get sweaty palms, some people physically body sweat, and some people also have issues with concentration as well as sleeping. And so with anxiety, one of the very important things to do is to slow down if possible, find times to take breaks, periodic breaks, where we can step back, where we can relax, where we can depressurize, as I call it, and just slow down the tempo. Additionally, and this is something that when a person has more intense and acute anxiety, a person may also have to seek medical attention from a doctor or psychiatrist to have some kind of medical intervention for in terms of medication, so that they can better cope when it gets out of hand.
Right.
The doctor, Dr. Esther Trotman, she, as I mentioned, is a frontline doctor, and she's worked at the Harrison Point facility. She was sharing about how she copes, and some of the points she shared is that she usually she mentions that she's a Christian and she prays, she goes to God first thing. She also says that she does journaling, and that's something that, by the way, one of the things that we shared is we had a 15-day challenge where we encourage persons to share something they were grateful for, do a daily meditation, and read a chapter a day or something inspiring or motivational each day. And so she shared that she does a lot of journaling. She says that she takes time at the end of her day to relax. She uses aromatherapy, candles, and she listens to quieting music and sometimes movies.
You
And she
know,
found that those help her to cope after a long day.
thank you
My
very, very
pleasure.
much. Good to see you.
Once again, you can follow Instagram or Facebook, Insight Consulting.
Insight Consulting on Instagram and
That's right.
Facebook. So meditation is also very good for the soul. So thank you. You take care. Stay safe and stay well.